Good morning, everyone. Welcome back to Live Well. I'm Lisa Krch, and this is the segment I like to call the Skincare Spectacular. We have a very special guest, very knowledgeable in all things skincare here in Bakersfield. This is Dr. Milan Shah of Beautologie.
Yes, hi. Thanks for having me.
Thanks for coming in. This is so exciting. You and I have been talking for the last hour or so now about all the great things we're going to be discussing. Let's start with the procedures, services. What do you offer there?
Sure. So, at Beautologie, of course, we are a cosmetic surgery, plastic surgery, and MedSpa facility. And what I specialize in at Beautologie is all the non-surgical aesthetics. I do everything in the cosmetic world that doesn't require a knife. Things from laser procedures, lasers to go after sun damage, lasers to remove hair or veins, to injectable treatments like Botox, Dysport, and facial fillers. And then we do a lot of skincare, medical grade skincare. And so, again, everything that you can think of in the cosmetic world, that's non-surgical, that's your in and out type of procedure. That's my cup of tea at Beautologie.
And you're very busy. You guys have we offer a lot of different services, so you do have a lot of business coming in, I know.
Yeah, it's really busy, and of course with summer coming up, everybody's wanting to get ready for that bathing suit for the summer, or maybe a wedding, a springtime wedding, and so it is especially busy right now in the office. But we love it. We love it.
What types of myths do you have people say? Hey, I'm afraid that if I do this procedure, I'll look frozen, or what kind of things do you hear, and how do you answer those concerns that patients have?
Sure. There are a lot of concerns, and the thing about it, they're very common concerns, and it's actually these concerns that actually stop people from making that first step and coming into our office. And yes, that's actually the frozen thing is a very common concern we get, especially with wrinkle relaxers, with Botox and Dysport. Patients are afraid they're going to lose their expression or look fake or plastic. And in reality, all we're really doing with Dysport or Botox is trying to get rid of the lines that go with the expression, not the expression itself. And if it's done by a qualified personnel and in the right amounts, that's all we're doing. We're getting rid of those expression lines. You're still going to be able to smile, laugh, squint. You just want to have the lines go along with it.
And this is something that men and women of all ages are seeking nowadays.
Yeah. It was definitely for the longest time a female-dominated industry. And, years ago, when I started my practice 10 years ago, I would occasionally see a guy come in, for laser hair removal or so. Now things have changed quite dramatically. The stigma is gone. I would say, especially in the non-surgical side, 1 out of every 5 or 6 gals that come in or patients that come in is, there'll be a gentleman. So it's becoming a lot more popular. We want to look good too.
That's a great point. Okay. You have offered, I have never had a Botox injection at all, and you have offered to allow me to see what it's like firsthand. So what I'm going to do is maybe you can explain to people what we're doing here.
Sure.
I'm taking the glasses off, so we're getting serious.
That. So, I wanted to, bring in a little bit of my injectable treatments this is great. It's a great forum. We could kind of show what it's all about and maybe alleviate some of the anxiety that's out there about getting an injectable treatment.
Sure.
What we use, we're going to use a product today called Dysport. It's a wrinkle relaxer. And what it's doing is it's stopping, again, those lines that go along when you're squinching or scowling or smiling. And it's, very often we get patients that come in and say, hey, I'm not an angry person, but people think I'm angry.
Right.
So we use this to get rid of those anger lines. And so
even in the last year or so, I've noticed, I like to call it the Klingon crease, that thing right there. It just never goes away. If I put powder on it, looks 10 times worse. So I'm starting to see, I think, maybe the early effects of the aging process.
Yeah, absolutely. And, we have a better term for it. We call it bunny lines, not the Klingon crease.
But that makes it sound so much nicer.
Yeah. So that's exactly an area that we could target. And so it's a pretty quick treatment. We're just going to clean off the area a little bit and do a few little pokes, and you'll be all done.
Sure. And I don't have it. Go ahead and get about your work, sir. I'll keep talking.
All right.
I'm a little nervous, and I don't have a needle phobia because I give blood a lot, but I'm not going to look. When I give blood, I don't look at the needle. I don't think I'm going to look, but if you'd like to show the viewers, that would be fine.
Sure. The needle I use is actually very tiny. It's called a 30 gauge, one of the smallest needles they make. It's kind of like, if you get a TB shop, one of those types of needles. So
okay.
Very,
now,
very
did you
tiny.
do this to Scott Cox? Did he have a little
I actually
injectable?
surprised them on air.
Okay.
I didn't tell him we were going to do it.
Yeah.
Scott throws me for a loop every time I'm on. So I'm like, I got to have my that's going to be my way to throw him off track. And so, we did it all on air a few months ago. And he was a good sport. And
Well, he told me. He didn't tell me. He said on the air that it didn't hurt, but he's just probably being a tough guy. So.
Well, no, it's not really supposed to hurt. I'm going to make sure it doesn't hurt for you either, Lisa.
Fantastic.
Yeah. I'm actually going to give you a little ice pack here, and I'll have you maybe kind of dab that on the forehead. If it gets too cold, give it a little bit of a break.
Okay.
And give me just a second.
Sure.
We'll
Now,
get
if
all
people
set
are
up.
coming in to get this done, this feels really nice. I might just have to just go with it.
That's all yours.
And it's a good look for me. What do you think,
That's our
Liz?
parting gift.
This is a good. I might need that in the summertime all the time. So when people do come in for this type of injection, how often do they need to come in to do it?
So initially, it's about every 3 to 4 months. It does wear off over time, but for the 3 to 4 months that it's working, you got to think about it as preventative. It's making sure those lines don't get any worse. They're not going to come back stronger, and they might actually get better. So even though it's only working for 3 or 4 months, it's stopping the clock for those 3 or 4 months.
Interesting.
Yeah.
Okay.
All right, so are we ready?
I'm ready.
All right.
I'm
so
ready.
what we're going to do is maybe I'll have you kind of lean
Sure.
back.
I'm
in the
gonna
chair.
actually be your OR nurse as well, so I'll hold that up.
Do a few different things. Shall I come around the other side? Would that
Oh,
be-
however you're more comfortable.
Okay.
I'm good.
This is good.
Okay.
Yeah,
Yeah,
you know what?
I want to
Maybe
make sure you're okay with this.
All right.
Really, I'm fine.
I'm going to put the ice off to the side.
Okay.
and
Oh, I
we're
love the
gonna-
ice. I'm
yeah,
gonna
I'll
put it
give it
here.
back to you in a second.
Okay.
And what I'm going to do is I'm going to have you lean back just a little
Lean
bit
back,
for
leaning
me.
back.
All right, there we go.
All right,
Maybe
all
if you want to set your head in the chair.
Hold. Oh, this. Okay.
All right. So this is just a little bit of alcohol. We're just going to
Okay.
kind of...
What kind of alcohol? Not the kind I was hoping for.
Yeah. That's after the show, maybe.
Ah, fantastic.
Okay. So we're just going to sterilize the
Move this
area
out
a
of the
little
way.
bit.
Okay.
And again, so this product is called Dysport. It's very similar to Botox. It's we call it a wrinkle relaxer. It's a category of wrinkle relaxer, and this one actually works a little quicker than Botox, and I'm sure you're going to get a wonderful result. So do me a favor, give me a nice big frown one more time. Perfect. And so yeah, we're going to go after those little bunny lines that go across, and you don't really have bad frown lines, but we're going to put a couple dots in there to make sure they stay at bay. Okay. Are you ready?
I'm ready.
All right. Here we go.
Frowning still or no?
Go ahead and relax now. There we go.
Okay, easy for you to say.
Little poke. Okay, so that's one of the pokes. Are you doing okay?
I'm doing fine. No problem.
Not
Am
too
I
bad.
fabulous? Am I
You're
fabulous?
doing great. You're not even flinching.
Good. Ooh.
Couple more pokes here. I'll be done in just a sec.
Now, I do have a little scar tissue right about where that injection is going right now. I stood a little too close to a scope on the other end of a 30-30 when I was 12 years old.
Oh, wow.
And so that scar tissue you're seeing, will Botox benefit that at all, or is that more a filler deal?
Well, actually, what happens is, I'm going to do 2 more quick pokes here. What happens with the scar tissue is these muscles actually, over time, make that scar look a little worse. It indents that scar even more. And so by putting a little bit of Dysport in, we're going to prevent that from happening. We're actually all done with the shots.
Hey,
It's going to
no
prevent
problem.
that scar tissue from imprinting, from indenting anymore. So, in fact, yes,
Great.
it will definitely benefit it. Yep.
Sorry, they're telling me to put the mic on you.
Oh, sure. I'm sorry. I'm just going to hold a little pressure here.
Okay.
You're actually not bleeding bad at all, but I want to make sure, you don't get a bruise, so we're going to hold a little pressure on there.
Okay.
But yeah, again, it's going to help that scar tissue. It's going to make sure that scar tissue doesn't get any more etched into the skin. So yeah, you get 2 for the price of 1 with this.
Wow. And I will tell you, I'm sure people want to know what it felt like. And ladies, it's like plucking your eyebrows. That's what it. Actually, this didn't hurt nearly as much. I need to see a professional.
Yeah. Well, you did great. You're
Thank
going to
you.
be a little puffy here for about 30 minutes. That's actually just the liquid itself. It's kind of like water, injecting water underneath the skin. And so over the next 30 minutes, it's going to kind of dissolve away, and then it won't kick in right away. It's going to take a couple days. By this weekend, you'll see it kind of working a little bit better. By next week, you'll see it in full force. And then you'll get a good 3 to 4 months of duration out of it.
Oh.
Yeah. You did great. I'm going to give
Thank
you
you.
an ice pack back.
Ah,
You just kind of dab it on
yes,
there.
I
That's
do.
yours.
Thank you.
I brought it just for you.
Okay. Now, what happens? Does anybody ever have an allergic reaction to this sort of thing?
To Dysport. So that's a wonderful question. And are you doing okay?
I'm doing fine.
Great.
Yeah, I can't believe I just did that live.
So great question. This isn't made from any animal product, and usually some of the stuff back in the day, the collagens, some of the stuff that were made from animal, like pig or cow sources, there are a lot more
Right.
tendency to have an allergy to it. Not made from animal products. The chance of an allergic reaction is extremely remote, but of course you could be allergic to anything.
Yeah, and you wouldn't know until
wouldn't know.
yeah.
I'll tell you, I've done probably several thousand, if not tens of thousands, of Dysport and Botox treatments in the last 10 years, and knock on wood, I haven't had a single allergy to this product ever.
Really?
And so it is pretty safe. if you were to get an allergy to it, of course, we'd have to treat it accordingly.
Okay.
Yeah.
Well, since you're here, we have a couple more minutes. I'd like to find out, I know people, especially in Kern County, spend a lot of time in the sun, a lot of aging spots, things as we age pop up. What can we do to treat that sort of an issue?
So with age spots, lots of different things. We could start off with prescription-grade skincare that actually turns back the clock a little bit by exfoliating the skin and getting rid of a lot of those age spots. If they're, maybe a little bit of an older clientele or somebody that's actually had a lot of sun in their youth, we have laser treatments that work really well to go a little bit deeper down to burn away some of that pigmentation or some of that loose texture skin, kind of exfoliate that skin a little bit deeper down.
Okay.
So, basic things to a little bit more aggressive things, all in-house, all in and out procedures that we do right at the office with relatively little downtime, depending on what we're going after. But yeah, there's a lot of different things we could do to go after
so
sun aging.
much. And
Yeah.
if people would like to get more information on the services and the products that you offer, you guys are pretty easy to find.
We are, we're right in the center of town, right there off Truxton Extension. We have our website, Beautologie.com, that you could at least get a lot of basic information and kind of get your feet wet. We always encourage our clients to just come in and talk to us.
Yeah.
My consultations are totally free. And again, there's a lot of apprehension about this stuff. And so we're just there to kind of disprove some of those myths and really talk about what the best thing is for you. Because sometimes patients think they need a lot more and they don't really need a lot, or vice versa, And in our office, we kind of offer the full gamut of services. And so we will direct you in the right direction. And then in the end, the choice is yours.
Dr. Milan Shah from Beautologie, thank you very much.
Yes,
for,
thank you. I look
goodness,
forward to seeing your results in a
Well,
week.
yeah, I was just going to invite everyone to join us next week. See how my forehead's looking. We're going to be live in Oxnard. Why? Because we can. Don't miss it. Live well, everyone. We'll see you next week, next Wednesday on Bakersfield.com.